So to recap, the clothing that you need during pregnancy, labor, and the postpartum period is all different because it all has different functions. So we talked through all of those kind of things and then also a list of what to bring in the hospital bag. But remember, that whole list is in the baby manual. Hi, you're listening to Season 4 of the Baby Manual podcast, the podcast that helps new parents all over the world navigate the everyday challenges that arise when you have a young baby. This season will help you decide which pregnancy, baby, and toddler items you actually need and which ones are a waste of time and money. I'm pulling on the knowledge of hundreds of thousands of new parents around the world, other pediatricians, doctor moms, the Academy of Pediatrics, breaking pediatrics news sites, all to give you the best information and recommendations that I can because I know how overwhelming it can be. I'm your host, a pediatrician, a mom, and an author, Dr. Carole Keim. Hello, welcome to this week's episode of the Baby Manual podcast. Today we're going to be talking about things that mom should have for herself. So this is during pregnancy, for labor, in the postpartum period, and then at the end I'm going to tell you what to bring in the hospital bag when you're in labor and about to have your baby. All right, here we go. So for pregnancy-related items for mom, if you are still pregnant, you're going to want to get some new bras. I know that when I was pregnant, my bra size went up 2 cup sizes and 2 sizes around as well. So your breasts will get bigger. That's one of the first things that you notice changing, and you might need to buy a couple of new bras as your pregnancy goes on. And then also afterwards, especially if you're breastfeeding, your breasts are going to get even bigger then. So just remember that you don't want to buy a whole set of new bras. You might just want 1 or 2 to get through, this current size because it might still change as pregnancy goes on. But you do want ones that are really nice and comfortable and have some good support and are, have some decently wide straps to help with your back as well so you don't get back pain. In terms of shirts, I found that maternity clothing, the shirts especially, are really great at being flattering while also not showing too much of your breasts now that they are bigger, and also kind of minimizing the belly area so that the bump is not as obvious. So I really like the maternity clothing. Even when I wasn't pregnant, I found myself shopping in that section because those clothes just kind of fit and feel really comfortable. But yeah, the maternity shirts, I feel like, are ones that you'll probably want to get somewhere around the 1st or 2nd trimester. And then by the time you get to the 3rd trimester, you're definitely going to need them. So in terms of seasons and seasonality of your pregnancy, just keep in mind long sleeve shirts versus short sleeve shirts, sweaters, jackets, that kind of thing. In terms of pants, so for pregnancy pants, there's 2 main types. There are ones that have a band of fabric around the waist that goes all the way up to underneath the bra line and covers your whole belly. And then there's a second style that sits underneath the baby bump. And so it goes kind of low down over across your hips. And both of those have stretchy waists. I would suggest trying on both kinds of pants before deciding if you like one better than the other, or if you want to get a little bit of both kinds. With the ones that have the wider band that goes all the way up, I found those stay up better. They felt to me like they were really kind of like hugging my body better and staying on. And I didn't have to worry about my underwear showing if I bent over or squatted down on the ground or sat in a chair. And the lower ones, I found that could sometimes be a little bit of an issue. But the ones that go over your whole belly are a little bit warmer. So if it's summer, I found those hard when I was pregnant during the summer to wear those because it was just too hot. But really great for in the winter. So things that you don't really need in terms of pregnancy clothes, you don't need pregnancy pajamas. You can just get bigger pajamas. They're pajamas. Nobody sees them. You just need like a size or 2 bigger. You don't necessarily need a pregnancy swimsuit. If you wear a 2-piece swimsuit, you don't need a pregnancy swimsuit because your belly is between the 2 pieces. If you want a 1-piece swimsuit, then yeah, you probably will want one for the 3rd trimester of pregnancy. And again, go with the seasons. If it's that time of year that you might be swimming, then you might want one. And in terms of dresses, so for things like comfortable summer dresses, ones that are made out of like t-shirt material that are stretchy and soft, those are great. You can just get like regular dresses that are a size or 2 bigger than you would normally wear, or a few sizes bigger towards the end of pregnancy. But in terms of fancy dresses, if you're going to an event, you might want to get a maternity dress. And there are groups online on Facebook, like Buy Nothing groups, local groups. You can see if anybody has any. Maternity dresses are something that are pretty expensive, and usually you only wear it like once, maybe twice, and then you're the wrong size for it. So they're not terribly useful. So it's really good to find one that is secondhand if you can, has been passed around. There's also secondhand kids stores all over the place for child items like clothing and stuff. And I would suggest looking there as well for maternity clothes. They usually have a couple of things. You also may or may not need new shoes when you are pregnant. You're going to gain weight. You're going to need really good arch support. So make sure that your feet are very comfortable at all times. You want to wear flats because your joints get looser in pregnancy and you're more likely to roll your ankle if you're wearing high heels. But if you're already wearing comfortable flat shoes, you may not need to get any new ones. You might need to size up. And some of that could be due to swelling during pregnancy, which is normal. And also, some people have told me that their feet grew a size when they were pregnant and it never went back down. And yeah, I think I went up a half a size when I was pregnant. So it can happen. So yeah, you may or may not need shoes. You don't need new regular socks, but you can get compression socks for pregnancy as well. If you tend to get swollen, compression socks can be really good for when you're at work, if you're doing a lot of sitting, or if you're going to take an airplane flight or something like that. The socks are great. All right. Now, when you're in labor, quick caveat, you don't really need anything special for when you're in labor because you're going to get to the hospital. They're going to give you a hospital gown. They're going to give you those socks that have the rubber on the bottom, and that's it. So you don't necessarily have to bring anything. But there is something called the Lila labor gown. They have actually a few different styles. I'll put a link in the show notes for this. This labor gown, I loved it. It has snaps that go along the sleeves. So easy access for nurses if they need to do things like, blood pressure checks or check your IV. There was a low back so that they could put an epidural while you were still dressed, which was awesome, but it covers your butt, so your butt's not hanging out like with the hospital gowns. There's also snaps that go kind of across the belly so that if you get too hot, you can air out, and also you can take out a breast for breastfeeding, and then snaps that also go down the middle of the chest. So it's like really accessible, buttery soft material, so nice, so comfortable. That made my labor, I feel like, a little nicer when I had that versus when I was in the hospital gown the other time. But also, you're having a baby. I mean, you're going to be uncomfortable and you might really not care that much about what you're wearing. And you're probably going to get blood on whatever is there. I don't know if anyone's told you yet, but when babies are born, there's always some blood that comes out because when the placenta separates, there's blood. And that gets on your clothes. So I would say don't bring your favorite thing if it might get stained. You might want to bring some slippers to the hospital. My favorite slippers are the Crocs slippers that have the fur inside. I know they're not pretty, but they're rubber and they're a nice hard rubber. So they have good grip on most floors. And if you stub your toe in them, you don't get hurt. And so that's why I like those ones specifically. Also, they slip on. You don't have to bend down to put it onto your foot. Yeah, so that's kind of everything I look for in a slipper, I guess, is that it's not going to slide around on the floor, that I can just slide my foot in and out of it really easily, but then it won't fall off while I'm walking, and that it protects my toes. So the Crocs ones are my very favorite for that. Incidentally, those are made in my hometown of Boulder, Colorado. Kind of shout out. Yay, Boulder. All right, for postpartum stuff, something that I thought was really surprising when I first had my baby, but I heard about it on all of my doctor groups online, was bring in Depends to the hospital. And I thought they were joking, but Depends, like, the underwear, the disposable underwear that is absorbent, is actually pretty amazing when you've had a baby because, like I said, there is bleeding and you're bleeding for usually several weeks after your baby is born. But for at least the first couple of days right after giving birth, your body's really tired and it's kind of hard to move around, and you need something that really has good coverage that you're not going to like lay sideways and leak out. So Depends are really great for that. If you're not into that, you could also do something like overnight pads, like some really big ones. You don't have to bring any of this because the hospital will give you disposable underwear and pads that go inside, but the pads that they give you are usually pretty thick. They kind of feel like you have a pillow in your pants. So if you have some pads that you like or you want to do disposable undies, those are great. Also, period underwear are nice because those are basically regular underwear like 2 layers of underwear with a layer of plastic material in between that doesn't allow any liquid to go through. So those are great for catching spillovers. So if you want to do overnight pads, you can put them in those like period undies. Those are great too. And with the period undies, I looked into a bunch of different brands of these, and I've tried 3 different ones on Amazon. I'll link my favorite one for you guys because some of them I found held up better than others. Some of them weren't stretchy enough and weren't comfortable, and some got really smelly when I used them and others didn't. So I'll link the ones that I like down below. Sweatpants or dresses are also really helpful for postpartum because your, again, body is recovering, and it's just real easy to slip in and out of those sweatpants or, to put a dress on so that you can go to the bathroom and not have to be moving a lot, bending a lot, that kind of thing. Your whole body gets sore after having a baby. It's normal. I was surprised to find out my first time that my regular clothes didn't fit immediately after giving birth and realized that of course not, because when you're pregnant, you gain weight in your whole body. It's not just in your uterus. It's really your whole body that puts on weight because your whole body is getting ready to feed a baby for a year out of its own resources. So it needs to do that. So your pants, your pregnancy pants are probably still going to fit when you're leaving the hospital. You might want to take some from like the middle of pregnancy because you're not going to be quite as big as you were at the end, but close to that. Yeah, if you have just some nice like stretchy sweatpants or a dress that you can throw over and you don't have to worry so much about the size, and then there's nothing like clinging against your belly. Also, if you've had a C-section, a dress is going to be a bit more comfortable as well because anything that lays across the C-section scar is really uncomfortable. So yeah, I would suggest bringing that for the postpartum period in the hospital. And what you don't need necessarily for postpartum is, like I said, your pre-pregnancy clothing, just because it's not going to fit. So I would say for mental health reasons, put it into a box, put it into storage, label it pre-pregnancy. And then as soon as your maternity clothes are starting to feel loose on you and they no longer fit, then you can open that box again and pull those pre-pregnancy clothes back out and see what still fits. But you don't need to try to fit into those in the immediate postpartum period. It took 9 months to grow this baby and for your body to change. It's going to take at least that long for it to go back to how it was before that. So give yourself some grace and hang on to those clothes, but don't try to put them on yet. Also, your bras from before pregnancy, they're definitely not going to fit. So hang on to them, but don't try them on yet. All right, bring in the hospital bag. So I hear this question all the time online. Like, what should I bring when I go to the hospital? What do I need to pack in my bag? What kind of stuff do I absolutely need? The short answer is the hospital has everything that you could need, but there are some things that might make it extra nice. So those kind of things that I would suggest. For mom, I would say outfits that have access to your breasts. I didn't realize this the first time, but if you're planning on breastfeeding, you need to be able to get your breasts out of your clothing fairly easily. So a breastfeeding tank top, a breastfeeding bra, breastfeeding t-shirt, these are all good to have with you in the hospital because you're going to use them. And or else you can be in the hospital gown, that's okay as well. It just doesn't cover as much. So the breastfeeding tops are really nice because you can stay mostly covered and have some privacy, but then still feed your baby. Nipple cream. They do have this at the hospital too, but if you have a special brand you like, nipple cream is like chapstick for your breasts. You know how when you lick your lips too much and they get dry and they kind of burn? So the same thing is going to happen to your nipples. It's the same kind of skin, and your nipples are not used to being sucked on 15 or 20 times a day by babies. So they're going to get sore, they're going to get chapped, and nipple cream is a lifesaver. So find one that just sounds good to you. They're all pretty good. The Mother Love one is one that I especially like, but they're pretty much all good. Breast pump. If you're going to use a breast pump, you should bring it with you to the hospital because the nurses there can teach you how to set it up, how to use it, walk you through it. They're not super hard. And once you've done it once, you get it. But it's really nice to have help setting it up the first time because it's not super, some are more intuitive than others, but a lot are not very intuitive. If you're doing a regular breast pump that has those kind of trumpet-shaped flanges that come out, you're going to want a hands-free pumping bra to hold it in place because your arms will get very tired trying to hold those pumps in place. And you're going to get a lot more with the pumping bra because it provides a little bit of pressure against the breast. So it kind of holds those pumps right in place, but in like strong enough that it's also causing more milk to come out. So I definitely recommend getting a hands-free pumping bra. I'll link one of those too. It doesn't look like a regular bra, the one that I like. It just goes around your body, so you don't have to take off all of your clothes, put that on, pump, and then take that off again and all of your clothes, and then put on a different bra. Because the pumping bras have holes over the nipples. So like you can't wear them as regular bras. So the one that just goes around your body is the one to get. And you need one that has like a clasp on it and a zipper. Bring those pads or Depends with you. Bring your phone and charger, maybe a computer and charger if you want, or something, a tablet, something to pass the time, maybe a book, knitting, whatever you like to do to pass the time. Some hard candies to suck on while you're in labor. If you like candies, I would suggest bringing some. The reason I suggest hard candies is because sometimes they won't let you eat when you're in labor because there's a chance that you might have a C-section, and with a surgery, you can't eat because it's risky. You have to be fasting for at least 8 hours before surgery. So a lot of hospitals won't let you eat during labor, but candies are okay because they'll give you a little bit of sugar and you feel like you got something at least. You are going to have an IV the whole time. So like you're getting your fluids and your salt and sugar that you actually need, but it's nice to have a little something in your mouth also, just to taste better. And then also you're going to want high protein snacks for after your baby is born. As soon as that baby comes out, every mom wants protein. All you want is you're going to want like meat and, or protein bars or protein powder, like just protein, high fat for immediately after delivery will help your body kind of replenish what you just lost. Also a water bottle, if you have one that you like. The hospitals all give you a water bottle, but if you want your own, you can bring that. And then your slippers or socks. Remember, if you're wearing socks while your baby's born, they might get ruined. A list of your regular medications. If you have a picture of the bottles or could bring the bottles in, that's even more helpful for your medical team because then they can give you those same medications at the hospital. You're not allowed to take your own medicines that you brought in yourself. So the purpose of bringing them in is just to show them what you have. So you could just take a picture or write a list, but make sure you know the dosing and how many times per day that you're supposed to get them. Bring a toiletry bag. I feel like the best shower of my entire life where it was after having like all of my kids, each of my kids, because it's just, oh man, you're in labor for so long. You get so sweaty. It's a serious workout. And then afterward, you get this nice hot shower and just having some of my own toiletries, like my shampoo that I like, and then my face cream that I like was really nice to have in the hospital. And then also I suggest bringing a copy of my book, The Baby Manual. That book will tell you, it has this list in it and also has everything you're going to need to know in the first year of your baby's life, but a lot of that information is very helpful in the first 3 to 5 days of life. So that book, if you haven't bought it already, you can get it on Amazon. There's also a link in the show notes. But the Baby Manual is helpful for both parents to read before the baby is born because it's really short. It's like 100 pages long. You can read it. My husband jokes he read it at least 5 times before our baby was born, but I think he actually did read it through 5 times because he doesn't read very much. So he really found it easy to read and he remembered all of the information in it. Like as soon as our baby was born, he was changing diapers. He knew how to burp him. He knew how to feed him. He knew how to make a bottle. He knew that you don't put a blanket in the bed. He knew how to swaddle a newborn. Like he's just doing all the things. And I was like, Peter, how did you know to do all of this? Like, how many babies have you taken care of in your life? And he said, this is the first one. And I was like, what? And he said he learned it all in the book. So it's really, I wrote this book. I'm not just tooting my own horn. It really is a good book. And it really has everything you're going to need. He felt like, he said it avoided at least 5 doctor's visits and 2 ER visits in the first 10 months of our kid's life. So it's definitely helpful. I highly recommend it. And bring it with you to the hospital because you're going to want to look stuff up while you're there, like the poop colors and things like that. There's lots of pictures in it too. So anyways, Baby Manual, all about it. All right. And then stuff to bring for your baby. You want to bring an outfit for your baby. And depending on how big your baby's measuring, if they're measuring less than the 10th percentile, you might need a preemie size of outfit. If they're between the 10th and 90th percentile, which is most babies, then regular newborn size outfit is fine. And if they're measuring over the 90th percentile, I'd still bring a newborn size, but maybe also 0 to 3 month size. Because those babies, they grow so quickly and they grow right out of those newborn sizes fast. You also want to bring a warm hat to bring your baby home. And most hospitals, I think actually every hospital I've ever worked at has volunteers that bring in baby hats. So every baby gets sent home with a knit hat, which is really nice. But also you might want to bring, some hats for your baby. Baby head sizes vary a lot. I'd say they vary from the size of an orange to the size of a grapefruit. And so you might want a couple of different sizes of hats, or at least a hat that is stretchy. So I'll link one in the show notes that is a good stretchy hat that should fit most newborn size heads. Also, the swaddle blankets that have Velcro in them are really helpful. And then the last thing you need, and actually the very most important thing that you have to bring to the hospital before your baby is born, is a car seat. The hospital will not let you leave without one. They cannot provide one for you. So you have to bring a car seat in so that you can take your baby home. They'll help you install it in your car and make sure it's all nice and safe. Thank you so much for joining me today. I hope this was really helpful. And next time, we're going to talk about the kinds of supplies you need, whether you're planning on breastfeeding or bottle feeding. Take care. So to recap, the clothing that you need during pregnancy, labor, and the postpartum period is all different because it all has different functions. So we talked through all of those kind of things, and then also a list of what to bring in the hospital bag. But remember, that whole list is in the baby manual. Thanks for listening. Remember, all of the links from this episode are in the show notes, and you can always go to my link tree, which is linktr.ee/drkeim. If you know anybody who is pregnant or has a little baby, tell them about this show. Maybe they would like to listen to this podcast. They might find something helpful in here. And if you know any friends who are pregnant and want to get them something for their baby shower, I would definitely recommend my book, The Baby Manual. It's meant to be all-inclusive. Really, all the questions that arise in the first year of your baby's life are in that book. So Baby Manual is also linked in the show notes and on my link tree. Have a wonderful day.